Hello, everyone. Hi, hi. Wow, there are people that is really, really on time. Love you guys. Thanks. First of all, I would really want to thank you guys for learning for your pets. Okay, I'm Dr. Lee. I'm a pet first aid instructor. Um, we are from PetMedic, and we love to educate people, especially pets owner, about pets, especially healthcare, diseases, and first aid. So this today, what the topic that we're going to cover is the common zoonotic disease in pets, right? So we'll probably leave about 1 more minute for others to come in. Now, whoever that help us to um, share this, I would want to ask for your help to share this class and this live to all the friends that you have, share in your Facebook and all that, to let more people to come here and learn about the zoonotic disease. Can someone share it out and also tell me what do you know about zoonotic diseases? Tell me anything that you know. So then I will be able to know, what is your understanding, and then we can touch, a little bit more about what you do not know. Okay. Next, people who help us to share. PetMedic is going to give out this free paw spray. It's a sanitizer. It's a pet-friendly sanitizer, for your pets. During this pandemic period, that's a lot of pets that's being used human sanitizer, which we find it a bit inappropriate. So this pet-friendly sanitizer, it's able to help your pet to sanitize without being harmful to your pets, right? So please share it out and tell me what you know. Wow, 冤气. Zoonotic disease, a disease infected and that can be transmitted naturally from vertebrate and okay, okay, 元气, great. Help us to share, and then our PetMedic team will actually look out for whoever that has answered my question and share our live to their friends. They will PM you to get your address to send this paw sanitizer to you. Great. Infectious disease transmitted between species from man. Vice versa, yes. Great. Thank you, Linda. Joanne, thanks everybody for sharing. Yeah, let's get more people to come and learn. I'll make it as fun as possible. Disease transmitted from animal to human. There are germs that spread between animals. Okay, great. Thanks, Steve. Great. Okay. Well, we'll just be showing you some of the testimonial that what the others have used, and then this is going to be 1 whole hour of learning. Are you guys okay with it? Hi, Wayne. Are you guys okay with it? If you say okay, type a 99. Type 99. If you're okay with this 1 hour learning, this 99. Oh, thanks. Okay. First of all, if you can stay for the whole 1 hour, wow, overwhelming. Thank you so much. If you can stay till the end, you stand a chance to win this big bottle of 500 ml of paw spray from us as well. But the best thing is that it's not that easy to win this. I'm going to ask you some question about the class, and then if you answer it correctly, and then you will earn the paw spray. Okay? Is it cool? It's cool. Then you can type cool, COOL. Okay. Now, first of all, I would want to thank Oh My Pet, this platform, to invite us to share some of our information about zoonotic diseases. Um, we really think that this is a very important topic that all of us should be at least well versed about. Yes, we can get information all over internet now. Here is a chance for me to explain to you further, and also if people that is friends that is in live now, you can also ask question here. If I can answer your question from here, I would love to answer a question from here. Okay, and those that is not really if I can't, I will actually explain to you, or answer you later in the chat. All right, great. So what who we are, okay, just tell you guys who we are. We are actually First Pet First Aid Academy. So we love to teach, and there are so many people like you guys that love to learn. Okay, so our mission is to educate 10,000 pets owner in 3 years, for pet first aid or any kind of pets education. Why is that so? Because we always believe that if the pet's owner is very good in knowing information and knowledge about how to take care of their pets live so much better. Their lifespan is longer, they get well taken care of, and then they catch the diseases so much earlier, like kidney diseases and heart diseases. Then those pets that actually have these diseases that get detected earlier spend a longer period of time. They can actually survive this kidney problem for even more than 6-7 years sometimes. So thank you. Let's start, I think. Great. It's already 8 minutes. I think whoever that wants to come in will come in. Keep sharing if you can. Just keep sharing to different group so that more people will come in. It's fine because we are going to cover 5 different topic today. 5 very, very common topic today. So if they come in between, they will still be able to learn from different topic. All right. So keep sharing to them. Now, first is rabies. Everybody knows what rabies is. I'll tell you further what it is. And then dermatophytosis is ringworm. Generally, people call it ringworm. Scabies. Scabies is what the Chinese call sangji. Okay. And then sporotrichosis, everyone call it sporo. And then leptospirosis, people will start calling them rat disease, All right. So let's go. Let's go. You guys ready? If you are ready, type another 99 for me. Okay. Why do we love 99 in PetMedic? It's because 99 symbolize our pets and us will be together forever. It's like 9 and 9. Jojo. Right. Thank you. Great. So rabies. What is rabies now? Rabies is actually one of the most devastating viral diseases affecting mammals. Okay. It's very prone in dogs, and also it can actually comes to human very quickly by this transmission from dogs and other mammals as well, not only dogs. All right. So it's a fatal disease. Why is everybody so scared? It's because it's fatal. Okay, I want you guys to understand, rabies and distemper are two different things. Okay, rabies and distemper are two different things. Allow me if I can actually sometimes use Mandarin to explain to you guys further on what it is. Okay, Rabies 是疯狗症 ，OK can die one. Human also can die, dog also can die. Okay, distemper 是狗瘟 ，dog can die, human cannot die. Doesn't come to human. All right. So usually the incubation period can be as short as 10 days to as bad as, as long as a year. Okay, next. So in rabies, right, what I'm going to try to do, I'll touch one by one of what I want to explain. If in between, if you really feel like you don't understand what I'm talking about, do feel free to put your question in the comment box, okay? Now, how does rabies come into us? Is that, let's say, an animal like raccoon or even a dog that actually bite us, human, the virus will actually enter the tissue of a human being and actually goes to the tissue from the saliva, via the saliva. So you actually can see that the rabies doggy, right, always have a lot of salivation. The virus will first replicate in the muscle first, okay? They build their army in the muscle. And then after that, they will go into peripheral nerve system, okay? Peripheral nerve system is the peripheral nerve system is the one that control our fingers, movement, motor movement, and all that. From there, it moves into your spinal cord. Spinal cord is the nerve that actually inside your spine, okay? And if they move into spinal cord and then they move up to the brain and then cause very bad encephalitis, okay? When they cause viral encephalitis, what will happen? Other than fever and all that, you will have seizures, okay? So virus travel from brain via all these nerves and other tissue. Then it goes to the eye, it goes to the kidney, it goes to salivary gland, okay? Next. So now that we know how it transfer from one place to another, actually, we also would want to know the symptoms. How do we judge whether the dog is actually already kena this rabies or not? Remember that I think a couple of years ago that we have this problem at the Thai border and Penang. It's really devastated to see the dogs are being killed because of this rabies panic. Okay, so first phase when they when they get bitten, the dog will be very very quiet. Okay, some will be very quiet, very 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 sudden one, like those very very active dog suddenly become very quiet. Some very quiet dog, then he become very agitated when you poke him or you play with him and all that. He suddenly become a change of temperament totally, and it's always sudden. It's always a sudden change. That's the first phase. After the first phase, after these 2-3 days of first phase, then they will have about 1 week to 10 days of this furious stage. Furious stage meaning to say that they become very aggressive. A little bit of noises and all that actually will trigger them very badly, and then they will always want to be aggressive and salivating a lot. Okay, and then they will feel like biting something. Okay, they don't feel like eating, but they just feel like biting something. Okay, then they chew on stone, chew on anything lah. But not every dog that chew on stone and chew on your earth and rubbish is rabies lah. Okay, so after this aggressive stage, then when it has gone to the brain, the spine and the brain, then these paralysis start to happen. So then this dog, most of them can't even open their mouth properly. Okay, and then there are these stages or symptoms called the dumb rabies. In dumb rabies, what happened is you don't really see that much of aggressiveness, but the legs and the front limb will become will become not able to move. So the dog cannot really control the leg movement and all that, and they can't really control all the other of their muscle as well. So they can't really swallow properly, even they are being fed. Okay, next. We will want to know, is there any treatment? Okay, for dogs that kena rabies, there are no treatment. Okay, there's no treatment for it. Usually what we do, if you really really worry about this rabies, if your dog get bitten by another dog nearby the borders, you probably can quarantine them first. Quarantine them for about 10 days to watch for all the symptoms that I told you. Okay, within that time, right? Usually, if the dog is very normal after these 10 days, even though after being bitten for 10 days, so after this incubation period, they are still doesn't show that they have this aggressiveness, change of temperament and all that, meaning to say that most of the time they are okay. Okay, if any rabies suspicious dog actually bitten you, first what you need to do is, this is very important, please pay attention. Immediately you run water, immediately wash your hand, wash the wound very very thoroughly with soap or antiseptic and water, and please seek immediate medical attention. Why so? Because in human being, they can actually they have this post bitten vaccine, meaning to say that post exposure vaccine, meaning to say that you got bitten and this dog suspected to be a rabies dog. You don't want yourself to get rabies. So what you do is that you go to the hospital. Most of the clinic will not keep this drug, will not keep this medication. The hospital will also have to go to the hospital. It used to be very expensive. I think it will still be. I remember, I think I got this injection maybe about 12 years ago. It costs about 500 ringgit per injection and a cost of 5 to 6 injection. So day 1, day 3, day 7, and then day 10 and day 14, if I'm not mistaken. So you get this series of injection, so that even if really this dog is a rabies dog, you get this injection done, you might not come down with the diseases, come down with rabies. Okay. Now, vaccination for dogs can be done in area that is pandemic lah. So previously, Malaysia is actually clear from rabies, so we don't really need to vaccinate our dog. But the borders now, they are still vaccinating. Whoever that is actually being export, we will still vaccinate them. Okay. If you do see in your area that you suspect this dog are being actually affected with rabies diseases, this rabies disease, do not try to chase and kill them. Why? Because these animals, okay, animals being animals, right? When they have this instinct, if they know that you are chase them and kill them, what they do is they will keep running away from the territory where they are. The problem is, if they are not really showing sign, but they already have the rabies, the virus in them, and you chase them and they run towards different area, they will actually spreading to bigger territory. So try not to kill them. Okay, try not to chase and kill them. Let the authority to do it, but we also would want to actually advise the authority not to chase and kill them too. So usually what we do is we trap them and vaccine them. Okay, right, great. I'm done with rabies. Is it okay for everyone? If it's okay, then tell me what is the next topic that I want to share. I will want to quickly share these 5 topics with you guys so that you guys have some time to 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 answer your question. Right. Great. So next topic. What am I going to talk about next topic? Who know? It's already up. It's okay. Right. Ringworm. Anyone know what ringworm is? Anyone know what ringworm is? Great. Thank you, Vincent. Jace. Aries. Okay. Ringworm actually happens to both dogs and cats. Okay. And it's a very, very common disease. Want to ask a silly question. I assume all of you guys know about ringworm, right? I assume all of you have pets, huh? That's why you guys are here, right? So all of you that have pets, okay, who have get transmitted by this ringworm before? Who actually suffer from ringworm before? Right. Hi, Lai. Hi, Elaine. Your husband got right. Great. Disney got as well. Okay. Right. So let's talk about ringworm. So what is it? It is not a worm, it's not a worm. It's called ringworm, but it's not a worm. Why is it called ringworm? Like next. So, well, it is we can categorize them as fungus. It's not a worm. Why is it called ringworm? Because of the shape. Okay. So they are these few species that actually can cause ringworm. Okay. And you will actually realize that, right? These types of dermatophytes actually very commonly we can find it on animals. All right. But why they actually show the sign and symptoms is because most of the time they are young, very young or very old animal. They usually get this. Some of them immune suppressed. Okay. Some of them very stressed. You say, wow, dog and cats also get stressed. They get stressed. There are so many cats that get stressed and come down with urinary tract issue uh, for the first lockdown. I think they're so used to owner not at home and suddenly owner at home all the time. So it changes their urinary pattern and all that. Quite a lot of them get very stressed. Okay. Sometimes poor nutrition can cause stress as well. High density. High density means many dogs and cats live together, and sometimes very poor kennel management. Right. Next. How does it look? I'll make it as simple as possible, as fun as possible for you guys, okay? On the left side, you will see all these pets, when they get ringworm, how it looks, okay? And when in human, how it looks. So don't worry. Let's say you get it. You got the ringworm, right? Don't worry because actually most of the time it's self-limited, unless you two are immunosuppressive, lah. Okay. So how do we diagnose? How do we diagnose whether it is actually ringworm or not? Okay, next. So this is how it looks like, and then usually your vet will shine them to with the wood lamp. The wood lamp is something like our fluorescent light, so you will be able to see under the black environment with the wood lamp. This is how it looks like. Okay, this is how it looks like on the microscope, and the one like cotton is the one that we actually put on the agar to culture. That means we grow it. This is how it looks. Okay, so how do we treat it? Okay, how do we treat it? So what we do is usually we will treat it according to the age of the animal too. Sometimes some very young patient that comes to us, We don't use oral or systemic oral antifungal right away. Next. So why? Because most of the very young animal, especially those below 5 months old, their liver have not been developed well. So if we burden their liver by giving oral antifungal, which is systemic oral antifungal, it might cause some damage to their liver. So, and the dosage has to be really right. I would really suggest to you guys, especially those who actually help the strays, try not to work out on your own antifungal. No, no, no. I know all of you know about antifungal. I even know, some of you can actually buy it from Shopee lah and from pharmacy and all that. Please be very responsible because we know the drugs are expensive. We know the medication for antifungal are very expensive, even though you buy from the pharmacy, slightly cheaper, but it's still expensive. We would really want you to go back to your vet. Tell your vet that, doc, I actually have problem, taking care of these 10 different stray cats and things like that, and some of them have these, with this oral antifungal, I need a proper dosage. So let your vet calculate the dosage for you, please. Okay, it's very expensive, but please do not try to save some money, but you do not know you do a lot of harm to the animal that you want to save. It go against your intention totally, because you take them off the street, you medicate them because you sayang them, because you want to try to help them. But because you give the higher, um, improper dose of medication and you kill them slowly, which you do not know, it's going to be very, very sad. Okay, so try to do that. I think most of the vet don't really mind, write a prescription for you or something, but let them work on the dose for you, please. Okay, tell your vet. I think now you can always share with your vet what is your real problem on taking care of these strays, and they will find a way to help you in the proper way. So do not buy antifungal anywhere you like. Go back to the vet, get their proper prescription, right? Okay, you can use soap or shampoo. So very, very young animal, we don't use oral antifungal, so we use soap or shampoo that can take care of the fungal. Nowadays you can have those antifungal spray as well, to take care of this. Okay, you can use cream, but you have to be very, very careful, because most of the antifungal cream will have the systemic drug like ketoconazole as well. you know uh, if you really put a cream on them, please either put on the collar or the pillow or whatever thing that let them not to leak. All right. And sometimes, because it's immunity driven, meaning some too young animal or immune suppressed animal, what you try to do is you need to increase their immunity, and the same time actually give them the oral antifungal. Otherwise, if you only give oral antifungal, you get very frustrating, because and oral antifungal you need to give in a proper period of time. You don't try to give like a few days. Oh, looks like getting better, okay, I stop the medication. Please don't do that, because it will cause problem later on. All right. Great. I'm done with ringworm. Okay, I'm done with ringworm. I'm going to scabies now. Okay. So whoever is ready for scabies, please type scabies for me. Right. Please type PetMedic. PetMedic is an educational platform. Yeah. So next, scabies, come type one scabies for me. Thank you, Linda. Give me some love and some and some scabies. Okay, thanks. Jace, why is that yeah? Why is that yeah? Tell me. Great, scabies. Thanks. Okay, scabies. Scabies is um it's a disease It's a skin disease. It's a very common skin disease. And for Chinese, we sometimes call it sangji. So you always see this kind of doggy on the street. Actually, whoever that looks like this, most of them are probably a scabies patient. Okay, next, what caused it? Scabies mite, right, are really beautiful. This is how it looks like. You guys would think, oh, dog, you're crazy. Why are you saying that it's beautiful? We see parasite, right? We see parasite under microscope. We really think it's beautiful. Okay, you know why? Because that's how it look. Okay, those small little triangular things up there, it's actually their legs, the short stumpy leg, but it does have this long hair-like thing that actually help them to move around. So actually, they move really really fast. So scabies actually can pass from one dog to another, the dog to the cat, the dog to the rabbit to the cats to the human, all the time. Okay? So if you have rabbit, rabbit always get this as well. Or hedgehog also get this. Forgot to tell you. Yes, it's very sad for you to see dogs with scabies. Please ask your vet to actually they can, if you know almost the size of the dog. We actually have some medication that you can feed to these strays and help them to get rid of the scabies if you can't bring them to the clinic, because some of the strays are really scared of human being. They don't even want to come near you. But they are something that you can actually give it to them. Okay, go get your vet advice, give it to them, and then they can actually help this, just one time, sometimes one treatment or even two treatment maximum, the scabies will be gone totally. All right, great. Next. Okay, how does it look like? It's like, that's how it looks like in hedgehog. They look like they have a lot of scab on them. Rabbit, it always happen. It always gets from the rabbits' feet and even their ear pinna. You know, and cat's ear pinna, it will look like very very thickened as well. But in human, it's very different. In human, right, it looks like small small spots of cyst, like mosquito bite, but so much smaller, like insect bite, so much smaller. But it's very, very itchy. Very, very itchy. Yeah, I've got it multiple times. Tell me about it. Can someone tell me, any one of you have actually contracted scabies before? Joanne, don't be sad. You will now learn and help them. So I really hope all of you that get information from here, even teach your friend about it. Those that cannot come to the class, you jot down some notes that is useful, share it with them. I really don't mind. I really want all of you to know more and share more. Okay? Come next. How do we treat it? Okay? How do we treat it? Okay. So they are some people who will always say the skin injection. They come to the vet, then they will tell that, oh, we need the skin injection, doctor. The skin injection give already no itchy one. Actually, um, those are actually ivermectin. All right, most of the time, is ivermectin, doramectin kind of. I know you used not to know ivermectin so much, and now because ivermectin is so popular, most of you now heard of this drug. But this drug, this injectable, is actually poisonous, or it cause problem in sheepdogs or collies. Okay, so if your dogs are sheepdogs or collies, please do not use ivermectin group of drug. Okay, it cause nervous problem in them. Okay, they don't tolerate that well compared to other pets. All right, you can use spot on. I won't mention name, but fipronil, you can actually okay, fipronil It's I'm not related to them, but I will tell you what it is. Fipronil is actually frontline. Okay, uh, do not use frontline for rabbits or rodents. Okay, use other things. But frontline are very safe in dogs and cats as well. In very very young animal like the baby that you get, do not use the spot on, but use the spray. Okay, right? Other things that you have a lot in the market, you can use all these spot on, revolutions. What else? Um, Advocate. Yeah, all these things do take care. It's too many to tell you. I'm sure your vet can actually tell you too. Spray is, please use the spray in very very young animal. The frontline spray actually is safe also for cats and dogs below more than 2 days old. So those people who is actually always help the stray, please use the spray instead of the spot on. I know they hate it. I know they hate it. I know, totally agree. But please do not use spot on them when they're too young. Otherwise, they couldn't take it well. Okay. If you really don't know what to do, please bring your rescue to your vet. I know it's difficult now because of the MCO and all that. Very difficult to get your vet. But if you really need to choose for the babies, please use the spray instead. Okay. Great. I'm done with scabies. Okay, for human, I'll just talk a little bit about human. That is not in the slide because I'm not a human doctor, so I'm not supposed to share this. Give me some love because I have the courage to share this. Um, well, um, for human, right? There are some lotion if you actually suspect that you have scabies, and if you see those lesion, what you do is you write this word scabies and show to your GP and tell them that my cats or dog might have rabies, and then they will examine your skin lesion and see whether it's consistent with scabies, and if yes, they will probably give you the right medication. Otherwise, if they give you other things like allergy medication and all that, will not help your itch. Okay, so if you know now you know more that you have these small small dots and it's very itchy, right? Please goes to your GP or your pharmacist. They will actually have some lotion that you can apply overnight and then wash it the next day morning, and then maybe one or two application. Most of the time you'll heal. I have kena multiple times, so that is why I know. Okay, great. I think I'm on time. So if you guys are okay with this, can someone just call out the sporo? Just call out sporo. Okay, just type in sporo for me, and then I can go ahead and share about sporo. Who has heard about sporo? Okay, who has heard about sporo? Thank you, Aries. You're very supportive. Thank you. Hi, Roxy. Hi, Wei Yun. Who actually have seen cat that has sporo? Okay, I'm going to spend a little bit more time on sporo because I think it's very important, and especially what it can cause human being. That's very very important. And then also I would want you guys to share this information to all the rescuer that you know about this sporo. Okay, I don't even mind if you take down notes, share this information to them, please. Okay. Right. Oh, football got sporo before. Okay. I'm glad that she's okay now. Okay, next. Sporo really looks ugly. Okay. Cats that you see, cats or sometimes dog, not so much in dogs, but most of the times in cats. When you see the cats on the street looking like this and you want to help them, please think twice. Okay, I need you to think twice and be very very careful. I'm not saying that you shouldn't help them, but if you don't have the confidence to actually get them into the cage on their own without too much of forcing and fighting, please do not do that. Okay, it will jeopardize yourself and your family too. Okay, next. Okay, this is how a sporo looks like in cat and human. Okay, why am I so worried about this sporo is because not only it's like ringworm, it can be on the skin, it can also goes to your lung. Okay, there are these few forms. Okay, first is the skin form. So when you see skin form, you always see the lesion or your wound being non-healing. The cat's wound, when you always see these stray cats, right? Most of the time, if they fight lah, after they fight, whether you apply medication or not, sometimes after 5 days you see them, the wound will be dry already. If you actually see them every day with that wound after a week or two and it's still that bad, you might suddenly want you I now want you to remember what I say about sporo. Okay, I'm going to flash back and show you the sporo photo again. Please, Pang Jun, recognize this. Okay, if you see, it's always around the nose, the pinna, and sometimes the paw, but it could be on the body as well. Okay, so if you see a cat that keep having this non-healing wound, I want you to straight away think about sporo. Okay, whatever that you don't learn today, please remember this. Next. So next function. Okay, thanks. So for cutaneous skin, it's how you look like. So in person, it will be quite restricted as well. Usually, when we touch them or touch whatever contaminated soil or other things or cages or things like that or plant material, then it's on us. And then if we have scratches or suddenly we have mosquito bite, we scratch, the skin get break skin, right? And this poro find a chance to start to grow there. That's the lesion. That's what you get. All right. Pulmonary, that means lung. That means it can go to the lung. It's very rare, but these fungus spores, because it's fungus, so the spores actually will fly inside in the environment and goes into your lung. You can inhale it, and then it goes to your body. So when you help a sporo cat, don't bring into your apartment thinking it's all right. Okay, isolate them. Give it a bathroom or something that the ventilation goes out, not coming into your home. Okay, you need to know more of this to be able to help more of these cats or dog in need. Okay, they are another form which actually called disseminate. So it can go to the bone, it can go to the joint, it can also affect our nervous system. Okay, sometimes it also can affect the system, the lymphatic system as well. So especially people with low immunity. So if you have old people at home, if you have immunocompromised people like SLE, lupus, and HIV carrier, all of these patients, human patient, yeah, do not bring any sporocat home that can actually, indirect or directly contact with these people. Okay, please don't. You will be bringing these spores to them and it will cause them major issue. Okay, next. Again, you see all of these harmful stuff, right? Looks so beautiful on the microscope. It actually looks like cherry blossom. Oh my god, it sounds very, very scary. I warn you. It actually goes to the cat and also goes to the human lung as well. So I need you to be super, super careful. Okay, next. You don't really need to know this because this is usually how we diagnose it. This is what it happens in human. It actually forms very bad lung lesion. I'm sorry, I cannot really get very beautiful a human x-ray for you guys to see, but I just want to show you it can be that bad. Okay, the normal lung that is supposed to be black, nice black, right? It becomes like this. Okay, What are the signs and symptoms? Okay, what are the signs and symptoms? Usually, is this small firm skin lump. Usually, it's very small, about 1 to 3 cm. But most of the time, it's ulcerating with discharge. That means you chut up one. So it's always, you see, ringworm just now you see, right? It's flat, just raise a bit on the side. This one is different. This one is a whole thing like a volcano, and then you have discharge one. Okay. Lesions are very, very commonly seen in the animal ear pinna, tip of the ear, here, nose, very ugly nose, and head. So just now I talked about human HIV. So if cat with FIV, feline immunodeficiency virus, 就是猫艾滋，有猫艾滋或者白血病的猫 or leukemia patients, they are also very, very prone to this. Okay. Some of them, when they get really infected, they will get very depressed, they get restless, they get fever. Okay. Next. So how do we treat them? So very easy. We treat them. So you treat them with oral fungal as well. Okay. Sporo, sporo is very dangerous. So oral antibiotic, you have to use oral fungal, oral antifungal. You have to use sometimes antibiotic for secondary infection, but try not to clean the wound. Some is very, very major big wound, we might get you to, wear some glove, drip on some medication, but don't bother to clean the wound every day. Why? That's where the sporo stay. Okay, that's where the sporo stay. If you clean the wound, then you didn't clean your hand properly, and whenever you handle this patient, please wear glove. Okay. I'm so happy to see all of you still paying attention. Thank you so much. Okay, try not to clean the wound. Why? Very simple, because it can come to human if you don't wash it properly. Okay, we don't want to get it first, we want to prevent it. So I will want to teach you how to prevent this. Okay, let's see how to prevent this. I'm sorry, it's 47 minutes already. I might delay a little bit. So please give me another 10 to 15 more minutes after 9:30. Thank you. For prevention, the most important thing is to prevent it. Okay, you prevent the spores from entering the skin. So you always wear glove when you handle sporocarps or even when you do gardening. Why so? Because these sporocarps, let's say this sporocarps is around your garden, and the spores actually drop on the soil. The soil will get infected, and when you do gardening, it can actually goes to the side, all that of your nails and your skin, and can enter your skin if you have any skin breakage. Okay. So some cats that look like a sporo cat, which you do not know, which is a stray, try not to straight away approach them, because if you approach them, if you're not careful enough, they scratch you, you get sporo. Okay, I'm not discourage you to help them. Please be very smart now how to trap them and how to communicate with them to actually bring them into the cage without you being too close contact of holding and scuff them like how you scuff normal cats. All right, please do not fight with them. Use squeeze cage if you can, and use squeeze cage to help with the treatment. Okay, squeeze cage is a cage like a normal steel cage, right? But there is one side that can move. Okay, if you don't know what squeeze cage is, you can Google it after this. Okay, so you squeeze the cat to one side so they get squeezed like that, and then those wound or those medication that you need to see or bring to your vet, that your vet can actually treat. The squeeze cage is very helpful. So you trap your cat in the squeeze cage, your vet will love you. Okay. Prevent bringing sporo cat home, please. Again, because it's so important, I must tell you 3 times. I don't want you to try to help the cat, but kill your own relatives because they are immune suppressors patient. Patient that is having cancer, pay attention, yeah. A human being that actually have cancer, that take immunosuppressive drug, um, uh, organ transplant patient or organ donors, um, lupus, those immune mediated diseases patients, HIV patients, all these chronic diseases patients which is very immune suppressed, do not bring the sporocat home. Get some other people help, or put them outside the house, to treat them, not inside your home, okay? Not with the same ventilation. All right, great. I'm done with Sporo. Okay. If you still have time, please stay with me. I have another of these very important disease to share with you. Okay. So what disease is that? It's called leptospirosis. Okay, you just say lepto. So lepto. Is everyone ready? If you're ready, please put lepto for me. Lepto always, most of the time, happens in dog. Okay. And most of the time, why I'm putting this dog's beautiful corgi that licks on the water at the street. I'm sure Bacon don't want to see this. Please keep Bacon away from this photo. Um, they leak from the street or from the pond or anything like that. It's because sometimes the water is stagnant, and then you have rats that is around. Okay, this is the easiest way to let me tell you what lepto is. Have you heard of a story or whoever that tell you that when you drink canned drink, you must wash or wipe or use wet tissue to clean where you want to drink the canned drink? Who can remember this? Put canned drink for me. Canned drink. Okay, who can remember this? 你喝汽水的时候，他们要你洗上面的。Why? Because of rat urine. What are they trying to prevent? Is to prevent the cat urine from contaminating, because when they store your canned drink, right? They store in the storeroom, so you do not know whether there are any rats that actually, yeah, parents tell you all the time. Why? It's actually because of this rat urine. And rat is the host that always bring this disease called leptospira. Okay, so that's why in Chinese it's also called the rat urine disease, 徐柳洞, okay, or 徐柳病, okay, 鼠尿病. So now rat urine disease as well. There are some people. Okay, why we have to bring this? Aya doctor, we don't have rat, we have dogs only. Yes, you have dogs and you love your dog and you bring your dog for a walk. Why I'm putting that dog, drinking from the street, is because to let you remember, try always bring fresh, clean water for your pets. Do not let them drink from the stagnant water anywhere you go. Okay, whether it's park, I know all of you likes to bring them to Desa Park City to walk, and even diligently walk them on the street. Please do not let them drink from any stagnant water. You don't know what will happen. Okay, next. This is one small tip. Next. So leptospira is actually a zoonotic disease that actually affect human and animal, that can actually affect all multi-organ. So it makes a multi-organ failure. People, doggy that come in can come in with a kidney problem, like acute kidney problem, very fast one, suddenly vomit. Then after that, 2-3 days later, become jaundice. Jaundice means yellow. Then after that, die. Not even a week, not even 5 days sometimes. So it's always called this special bacteria. This bacteria is also very nice. If you have time, go to Google this leptospirosis or leptospira on Google or YouTube to check on how they look like under the microscope. They move very beautifully as well. Okay, animals will always serve as reservoir. Okay, like rodents and some mammals, some small mammals, or even raccoons. But this disease rarely seen in cats. Most of the time, it affects the dog. Okay, so they become the reservoir. Then the urine out, they just keep passing out the bacteria. And then when the dog licks it, they ingest it, they will actually cause the problem. Okay, next. What are the symptoms in your dogs? Okay, first, it really depends on what are the organs that they affected. Like I told you, it caused multi-organ failure. Okay, because it's an infection, most of the time they will have fever. And why shivering? Sometimes shivering is because they started to get anemic. Sometimes shivering is because they are so sick with kidney with acute kidney failure. Okay, inappetence, don't want to eat lah. Muscle ache, very difficult to see them muscle ache one, but most of the time they will be like very very quiet. Okay, vomiting non-stop. Okay, and then dehydration because of vomit and all that, the dehydration, kidney and liver failure. Like I told you, sometimes you have eye and respiratory sign, and sometimes even neuro sign like seizuring. Okay, in this very very acute infection, I have to tell you, most of the time we are very sad if the household. I remember there are many times that the household. I remember one time very very clearly. I think it has to be about 15 years ago. Okay, this owner comes in with a dog with this acute kidney failure, and when we see the kidney, he vomiting non-stop, so we actually suspect lepto. And we look throughout, to try to find jaundice, we can't. And then we see starting the sclera inside the eye starting to have a little bit of, this yellowish tinge. So what we do is, she has 7 dogs at home. Okay, in this leptospirosis, for a treatment option, right, most of the time the one that really sick, we will take into the hospital, we treat them with drip, blah blah and all that with the medication. And we also have one medication that we can actually give to the owner for prophylaxis treatment. Prophylaxis means, let's say one dog kena, 7 dogs at home, right, we will assume all your 7 dogs kena. So what happened is, all these 7 dogs have this virus, have this bacterial infection. Then what we'll do is, we actually give medication to all these dogs that don't have symptom. Okay, so to the owner, she is already the second or third day that the dog got sick. That means starting to vomit, like the first day not really wanted to eat, a bit quiet, inappetence. The second day also very quiet. Second day night starting to vomit. And when she come to see us, it's the third day already. Okay. And when we third day we admit this dog, actually within 1 day, the dog passed away. Okay. And out of the 7 dogs, 3 more coming on that 1-2 days. And then long story short, we already give medication to all 7 dogs. So one died, come in to the hospital, and then died the next day. Out of the 6 remaining dog, only 3 survived. Another 3 passed away. So meaning to say that 7 dogs that actually got infected, only 3 survived. Even though before they have anything, you give the medication. So this is how fast this disease is. So imagine if you can pick this one up on the first day itself, when the dog is, not really in, when they are inappetent. When they are inappetent, when you bring to the vet wouldn't know as well if you don't tell them what happened. If you tell them that, oh no, I actually bring them to Desa Park City, well, they see the pond, they're very happy, and they go and play and drink some of the water from the pond. Could it be? Or can we check? Or even if the doctor don't see anything, but they suspect, they could actually give some medication to prevent it from happen, or prevent the really bad disease, unless the dog get infected very badly. So that's no way to tell. But you as the owner, you make a difference. Okay, trust me, you always make the difference, because you are the papa mommy, you see them most of the time. Okay, next. How do we want to prevent? All right. So as we know that this is very bad disease. So before it happen, we don't want it to happen. Who agree with me? Whoever agree with me, can you please put prevention? Prevention is better than cure. Okay, just put as prevention. Prevention is always better than cure. So that is why you are here. Okay, great. You're doing good. We're almost done. Okay. First, you identify the dog with the infected sign. Okay. So that all the staff, your rescuer, your pet first aider can actually take precaution. When you see this, when you see jaundice dog and all on the roadside, please do not go and just touch it, kiss it, and all that lah. Okay. Make sure you wear glove as well. Okay. How does the dog transmit to human most of the time? It's also from the urine. Okay, but definitely I'm not saying that you'll be drinking the urine lah. But most of the time you so sayang your dog ma, you always clean after them. And sometimes if you clean after them, whether it's on the floor or your wee pad, or even you wipe their cuckoo bird. So all of this will actually risk you from the bacteria staying on your hand or fingers before you wash it thoroughly before your meal. If you cannot wash it thoroughly, it is at your fingers or things like that, you just take some food and eat, there you go, you will also kena this disease. And in other countries, country like Philippines or Indonesia, places has a lot of water. They love street foods and all that. Quite many of the population will actually contract leptospirosis and die of leptospirosis. Even in Malaysia, people that go for those picnic, waterfall picnic and all that, they some of the children or even adult also die of lepto. So you have to be very careful. Just as simple as wearing a glove. So please, okay. Now you're so used to wearing your mask, right? So when you help the animal, wear your glove, okay? Bring your glove everywhere. So you take precaution before you actually goes near them, and then avoid direct contact with urine, blood, or vomitus. Okay, these are the things that easily transmitted to us. Okay, if you contact, if really the dog has urinate there, you do not know, it dries up and all that, the other dog that comes around that area and contact to it will contract it as well. Why? It's how I told you, right, that one dog that cannot be the rat go to all the dogs, right? So it has to be from that one dog. They share the living area, they share the house, they share the play area, they share the garden. That's why all the other 7 dogs also got this disease. Okay, so this sunlight can kill the bacteria, but it's better to disinfect. So when you disinfect, what do you use? Okay, you can use bleach-based disinfectant. You can use thing with chlorhexidine. Or even as simple as soap. Okay, when you clean the soil area with soap, you reduce so much of burden or the bacteria on the contact surface. Okay, but if you use bleach based chlorhexidine and all that, you actually disinfect that area well. Or how to use bleach based one, if you really don't know, as simple as mixing 1 part of Clorox to 30 parts of water. That's a really strong one. Okay, nowadays they recommend even up to 50 to 100 parts. All right, so wear disposable glove when you clean their bedding and all that. Great, I think I've done and you guys have done too. Right, you guys can now Oh, great. I'm just 5 minutes late. Thank you so much. Now, I have covered all that I want to cover for today. You guys think it's awesome? No, Jace, is 1 to 30. 30, or even up to 50. Actually, 30 is very, very strong already. So one part of water to 30 over parts of Clorox, it's a very old, yes. It's a older calculation. Now you can even go up to 50 parts of water. Yes. 1 parts to 30 parts. Yes. Can kill even most of the viruses too. All right. But you have to be very careful. When you use Clorox, I need you to be very, very careful. Yeah. When you mix and use Clorox and you spray around the bedding or the area that they walk on, right? You have to be very careful. It might hurt their paw and their skin. Okay. So what you want to do is that after you spray that, after about 10 minutes, so the contact time is 10 minutes. Okay. If you put contact time as 10 minutes, then you can actually rinse it off with normal water as well. Okay. Okay. The question is, yeah, just get the question come in. I think I will spend another 10 more minutes if you guys don't mind. If you guys are not rushing anywhere, I'll spend 10 more minutes to answer your question. Would that be good? Okay. So are you guys ready to answer and win? You ask me question, I ask you back question, okay? And whoever answer me first, my team will see your correct answer. I will tell your name and my team will send you your gift, right? Great. Okay. What is this? Kelvin say he's feeling smarter. All of you are very smart now. All of you are very, very smart even before you start because you choose to come. Where else other people probably watching Netflix. Not to say not good. All right. Just now I saw a question about Dettol. Dettol can kill most of the bacteria, no problem. Uh, Dettol in killing viruses might not be that efficient. Okay. Yeah, you can use Clorox for lepto because lepto is a type of bacteria. Okay, great. Thank you. I make it very easy. Hopefully, you guys can understand. So now, can I ask question? Any more question that you guys want to ask me? Please ask. Or I'm making it so clear that you guys don't have to ask me question. I want to ask. Give me one. Give me one. Uh, s- um, give me one symptoms for give me one symptoms for leptospirosis. One symptoms that you can see in your dog in leptospirosis. The first one answer will win, yeah? Quick, be the first one. All right. What are the symptoms that you can see is yellow eye. Okay. Okay. I will take this yellow eye as the answer. Okay, um it's not like superb answer, but why I want to do that because I think the photo that I put on really go through you, which we love. Okay. Well, so many people answer, so good. Fever. Well, you're very chin chai, oh, you all say fever, oh. Okay. Yellow eye is because it's jaundice. Okay, jaundice in Chinese is called 黄疸病. Okay, it's like 黄疸. So that is why not only the eye, you can see the yellow, like yellowish on the sclera, is the white color area in your eye that is yellow. Not only that, your gum is yellow, your ear is yellow or vomit. Great. I really think that we should give two. Let's give to the second one is who? Let's give to Vicky. I think Vicky is the second one. Did I get it wrong or right? Guys, please help me. Great. Let's give to Kim, Wong, and Vicky. All right? Great. Next question. Going to be harder already. Going to be harder already. Give me one prevention. Okay. How to prevent yourself from, oh, sorry, not yourself. How to prevent, wait, sorry. So kanchong, I don't know what to ask you really. So kanchong now. Okay, how to prevent your cat from getting sporo? How to prevent, okay lah, how to prevent yourself from getting sporo? Sorry, I rephrase my question. How to prevent yourself from, oh great, Philip, very good. Was so fast, Philip. Yes, is to wear glove. Great. Okay, should I ask more question? Okay, how do sporo, okay, tell me how do sporo comes to human? How does sporo come to human? How would you be able to contract sporotrichosis? Okay, now I'm gonna be very good. Pui, okay, Pui, I give you Pui. It's a very good answer that you say. Skin contact, yes, as well. Breathing in as well. I want you to tell me what is the thing that you breathe in. Oh, I'm gonna be so hard on Pui now. Pui, tell me what is the thing that is being breathed in that cause the disease in sporotrichosis. Very good, Pui. Wonderful, great student. The spores that you get inhale. So not only be careful with the cat, be careful when you do gardening as well. Very good, spores. So another one goes to Pui. Yeah. So how many already we give away? Is it the last one? Is it the last one? Great. Very fast. Yeah, Pui, very fast. Congratulations. Okay, last one. Last one, should I give simple? Okay. Let's talk about rabies. If you suspect that your dog has rabies, what do you do? If you suspect, thank you for others that is answering. Yeah, I feel so good. I feel so good that you guys pay attention. Thank you, Min. Thank you, Kelvin. Very good. Roxy say quarantine and okay, you know what? Okay. Wow. Okay. Seek medical care, yes, Puyi, but we won't be giving Puyi anymore because Puyi have it already. So the next one is Roxy. Roxy say quarantine. Very good. Liu, CY even do it better. CY, you do it even better. You say quarantine for 10 days. Excellent. Can we team? I'm sorry. Can you guys give one more to Liu CY as well? So you give one to Roxy and one to Liu CY as well. Okay, I'm exceeding my quota. I'm supposed to only give 5. Right, great. Great, everyone. Thank you so much. Right. Have you are you guys having fun? Okay. Now, I think we have come to the end of the session, but for all the others who really come and spend the whole entire hour plus with us, thank you, Xiao Lian, and everyone that's answered, Nicholas, Red. Thank you so much. For all the others who doesn't really get the prize from answering, don't worry. We also want to give you something for you. I mean, we want to really give something to everyone here. Okay, everyone, are you guys ready? Are you guys ready? Okay, come. Pang Jun, please show them. Please scan this code or click the click the link in the comment box. That we are going to give you the first aid kit builder. You just click them, fill in your details. We will send you your first aid kit builder, and then also 10 ringgit Shopee voucher to buy the paw spray that you didn't get just now. Okay, thank you, Oh My Pet, as well. And then this free first aid kit builder, meaning to say that you can know the list of things that is supposed to be in your first aid kit for your pets, and then you can actually build the first aid kit on your own. You don't need to buy it as well. Okay, and then please allow me to run a little bit of this advertisement for ourselves. Tomorrow we are going to have another class that talk about COVID. Okay, to give you guys some background, what happened is I have actually talk about COVID with our members quite many months ago. But why we are bringing this up again is because nowadays clients are calling me or members are calling me being very, very scared because they themselves get COVID. They worry that they pass to their pets. Okay, can your pets get COVID-19? Here and now, I can tell you a very short answer, no. But why do I have to whole hour to explain about it? It's because we want to tell you all the things that how you can protect your pets that really not getting, okay? Because you say, well, doctor, you say cannot get that. But I see so many report, like report from Hong Kong, report from where. So tomorrow, if I can, I will actually share with you about this. And why we are charging the fee is because we really want commitment. You guys are really good people that have 100% commitment. Love it. And we really want these people to come in. Whoever that pays the fees, right? We will send you back a free pet-friendly sanitizer, which already was $29.90. Okay, so there's no way for you not to come for the class. And whoever interested, please scan the QR and join us tomorrow. All right. Great. Great. Yes, yes, yes. Pui is so true. They can be contaminated like a doorknob. So true. So I'll see you tomorrow, guys, okay? See you guys tomorrow. Thank you so much for joining us today. Thank you, all my pets, for your platform. I'll see you guys again. Bye bye. Good night.